Now, that's a tough act to follow right there.
He's good. He's keeping us safe.
I was telling Kumara before we started, we gave this presentation back in June out in California. And I said, boy, it was really nice to be back at Cape Cod where the temperatures are relatively normal. Out in California, I think in June it was 118 degrees. I think that was the coolest day we had out there. But what I'm going to talk to you about is the victim services, how we respond to them once they're identified, and where we go with them. Because as Kate was saying, we're really playing catch-up right now as far as having services available for victims, both men, women, and children. There's just not enough to go around. And as I go through this presentation, you'll hopefully see that. But what I want to start off with, I'm the Victim Assistance Specialist with Homeland Security. I cover all of New England, all the 6 states. We actually have a human trafficking unit in the Boston office, which has 12 dedicated agents assigned to it, where they don't do anything but investigate human trafficking cases. We have 11 regional offices throughout New England, and again, all they do is investigate human trafficking and child exploitation. So you can see how severe the issue is of human trafficking right here in New England. This is from Polaris Project. This is all the calls that came into their national hotline number of human trafficking leads. So you can see the Northeast is pretty well inundated with calls to Polaris Project. And what I want to get into is the 6 stages of human trafficking. Kate actually started touching on it. And what a trafficker looks for in a victim, the first thing they look for is a vulnerability. They're very keen, they're very good at picking up a vulnerability in a person. Most of the places where these traffickers recruit are your local shopping malls, your high schools. We actually have victims within the high school who are recruiting for their trafficker, recruiting for their pimp. So they look for vulnerability. And one of the things they might say to a person walking around the mall is, you know what, you have beautiful eyes. You have beautiful eyes. And if that person looks up at him and says, you know what, thank you very much, I know I do, thank you, he knows that's not his victim. But if he says that to someone else and that girl says, no, I don't have beautiful eyes, and she's looking at the floor, he knows that's his girl right there. He knows that's who he's going to exploit. And he starts working on her. When I say working on her, he'll start whining and dining her, start giving her the things that she's probably not used to having, the nice jewelry, the pocketbooks, the fine clothes, going out to dinner at nice restaurants. And that's part of the recruitment process. That's how they recruit. It becomes a boyfriend-girlfriend relationship. That's how it's identified. That's how she's feeling. This is my boyfriend. We're going to get married and have that white picket fence, that beautiful home. This is what we're going to strive for. So the recruitment process, the recruitment and the grooming process might take anywhere from 3 to 6 months. And basically what he's doing during that time is just building the trust, building that relationship. She might even take him home, introduce him to her parents. And I've had several victims who have actually done that. They've shown me photographs at Christmas time all around the tree with the trafficker. Again, building the trust. And once that trust is gained, that's when the transportation comes in. They start isolating that person away from their family, away from their friends. So there is no support network, no helpline available to her or him. Between stage 3 and 4, he might say, you know what, in order for us to have this white picket fence, in order for us to have this beautiful home, we need to start making some money. And that's where the exploitation comes in. That's where he starts saying, well, can you do this for me? Just one time. Just one time. And one time becomes 3 times. 3 times becomes 4 times. Next thing you know, he's dropping her off at a massage parlor in Connecticut for 3 or 4 days to make some money. So the exploitation stage can last weeks. It can last several years. One woman that I'm working with currently, she's been in the line now for about 7 years, and she's just getting out now. Physical abuse, stage 5. If they don't comply, that's when the beatings come in, the gang rapes come in, the burnings, you name it, torture, anything that you can think of in hurting a person, that's what they'll do. If it means hurting their children, if they have children, they'll hurt their children. If they have parents, they'll hurt their parents because, hey, they've been to the house. They know where the parents live. We've had one individual who just was sentenced last month to receive 30 years in federal prison, and that was his plea bargain. But he actually shot his associate, his fellow associate, his trafficker that was helping him in the head, in the car, with the woman in the back seat, with the victim in the back seat. So she told me if he did that to someone who was working with him, what is he going to do to me? How's he going to treat me? So you can see the fear. You can see how they can say, yeah, he'll kill me for good reason. Stage 6 is the resolution stage. And that can look like 3 ways. They can either run away, which a lot of them don't, because they all end up coming back. They commit suicide as a way of not being able to deal with their pain. Or we get a tip, law enforcement investigates it, and we conduct a raid. Those are the resolution stages. And that's from Kevin Bales, who is a pretty well-known researcher in the field of human trafficking. There you go. So who are the victims? Basically, the victims can be anybody. They can be anybody. They can be husband, wife, daughter, aunt, uncle. They can be anybody. And as Kate said, there is no standard look to a victim. We've had individuals who were runaways, who were homeless. We've had individuals from mid-class families, from wealthy families. I actually had some parents who paid over $100,000 of their own money to get their daughter into treatment for substance abuse. And when you're talking about substance abuse, it's 1 step forward, 3 or 4 steps backwards in dealing and working with these women. And you just can't give up in working with them. The majority of the victims that we see are from sex trafficking rings. It depends on what part of the country you go to. Like my counterpart up in Buffalo, New York, he sees mostly labor trafficking victims. But here in the Boston area, Cape Cod, Manchester, Portland, Providence, it's all sex trafficking. And most of these women are addicted to drugs. And right now the drug of choice, as everybody knows, is what? Heroin, right. And most of these women are being paid in heroin. A lot of these women, too, when they first started, they weren't addicted to any drugs. They were given it to them by their trafficker, or they were forced the injections by their trafficker to make them comply as a way of control. So they become addicted. And the way the trafficker pays, again, is in heroin. And you know how severe the withdrawal symptoms are from heroin. So they give them just enough heroin to keep doing what they need to do for them, and that's to make money. Means of control, as I said earlier, drug addiction, torture, gang rapes, branding, tattooing, threats to family members, confinement, burning. Another thing they're starting to do now, we just noticed, is they're starting to implant under the women's skin GPS tracking systems, like they do with the dogs and the cats that you get from shelters. So it's a way of controlling them to know where they are, to know their location. Victim state of mind, as Kate said, they don't consider themselves victims. When you talk to them, they don't even know what human trafficking is. So I was up in Maine not too long ago, and we were discussing, well, maybe we need to change the term that we're we're talking about so they understand what it is. And I'm glad to see that you did that on your flyers too, because it's called so many different things. They don't see themselves as a victim. They see themselves as boyfriend and girlfriend. They see themselves as, this is going to be my future husband. That's what they see, until one day that light bulb goes off. And that's where Kate said, keep asking them, don't give up. I had one woman who I kept asking. She didn't want help. You just planting the seed, giving them the card, giving them something. And be careful what you give them, because if the trafficker finds it, there's going to be consequences. So this one woman, I hadn't heard from her in almost 3 or 4 months. And every time I did see her, I reached out to her, I called her, I met with her for coffee, and she didn't want help. And I said, well, when you're ready, help is here. For 3 months, 4 months, I didn't hear from her. Finally, I heard she was going to be over the courthouse in Boston. I had just missed her. And I'm in my office at the JFK building, 17th floor, and I get a call. It's 3:30 in the morning. I remember it like yesterday. This is a few years ago. And it was her. And she goes, hey, Peter, remember when you told me if I needed help, I could give you a call? I said, yeah. She goes, well, I want help. I said, where are you? I'm outside your office. I said, all right, I'll be right down. And we went down. We got her what she needed. We put her into a safe home. She was there for 2 years. And just this past month, she actually left the safe house and is now in her own place. Again, it's called not giving up and keep asking. We all know about the Stockholm Syndrome. We see that here as well. A lot of them do not know of their rights, especially if they're foreign nationals, that they have rights. They think they're going to be deported. We actually have forms of immigration relief that we can offer foreign nationals to where they won't be deported if they're a victim of a crime. Services for victims of trafficking. We do emergency room assessments, detox facilities. The safe houses provide a lot. Safe houses provide a lot of one-stop shopping, vocational services, educational services, mental health, medical assessments. But as I go on, we just don't have enough safe homes. Human trafficking didn't become a federal crime until 2000. So you're talking 16 years ago. So you can see why we're still playing catch-up. So our challenge is lack of detox facilities. When I say lack of detox facilities, we get inundated with women who are addicted to heroin. So much so that we had 2 hospitals identified in all of New England, Mass General and Boston Medical, that were expediting trafficking victims for us and helping place them into detox. So needless to say, they were getting saturated from all New England states. I'm happy to say now our 2 hospitals that we had, we're now up to a total of 8 hospitals that are now expediting these women and these men, and for medical services as well as detox facilities. We still have a ways to go, because if we put someone into detox, we better have a place for them to go when they get out, right? And unfortunately, that's where we're still having an issue. We still have an issue there. Because if we don't have a place for them to go that's safe, they're going to end up back on the street again. They're going to end up homeless, or they're going to end up back with the trafficker again. Detox will be another form of networking. I can't tell you the number of women who I put into detox didn't stay the allotted time and left with folks that she met there. And next thing you know, we hear that she's in a part of Boston, she was seen using with this group, and of course nothing good ever comes out of that. So again, like I said, it's 1 step forward, 2 or 3 steps backwards, but you do the dance. You do what it takes to get them the assistance. Lack of safe houses. In New England, we only have 3 safe homes in all of New England, which equates to about 23 beds. And when I get a call from our Manchester office saying, hey, Peter, we're going to do a raid next week, we have a potential for 13 victims. All right, where am I going to put 13 women when all my safe homes are full. So we started looking at that issue very closely. And what was happening is with 3 safe homes, when they apply for federal grants, they don't get the funding because they're so small, they haven't been open as long, they don't have the data. So we came up with this idea of forming the New England Trafficking Aftercare Coalition, where we bring all these safe homes, 3 of them, under this umbrella. And we had the law firm of Ropes and Gray in Boston who did pro bono work and made it into a 501. As a result of these 3 safe homes coming in, word of mouth started getting out around the New England area. We started finding other safe homes that were already up and running that we didn't know about, that these safe homes didn't know about. So now our 3 have turned into about 7, with possibly 8 down the line. But again, they're all filled. They're all filled to capacity right now. So we still have to be creative in looking at other ways to house these individuals. Lack of transitional services. Once they're in a safe house, they can usually stay there. The average stay is probably a year to a year and a half, but when they get out, where do they go from there? So we need some type of transitional plan. And right now what's been happening is they're working while they're at the safe house in the community, and they're putting money aside to be able to buy an apartment on their own when they get out. And again, lack of funding. We all know that story, right? So opportunities, we do a lot of training with medical staff, with detox facilities on what human trafficking it is, because it is a different animal. What's been happening in the hospitals is a lot of the doctors misdiagnose it because it runs so parallel with the domestic violence victim. Since we've been doing our outreach to hospitals, we've been getting a lot more calls from nurses and doctors saying, hey, we have a trafficking victim here. Hey, we need to place this person. What can you do? So our efforts are paying off in that regards. Hospitals are expediting victims for medical, psychological, and substance abuse issues. Told you about our safe houses and our networking to assist victims. There's actually one safe house up in northern Maine that's affiliated with St. Joseph's Hospital. St. Joseph's Hospital has partnered with them to where St. Joseph's Hospital is now giving all the residents free medical care. Anything they need medically is free of charge to the women. When I talk about safe houses, how many safe homes do you think there are for males? There's actually 1 in the whole country, and that just opened in January of this year in North Carolina. So just 1 for males. I believe outside of Raleigh. Yeah, so just 1. And it's not really a safe house because the community found out about it and started protesting it. Opportunities, again, developing one-stop shopping for victims. Quarterly, we do a quarterly service provider meeting, and anybody here is more than welcome to attend. Just let me know if you want to come. And what I did when I first took over this position is I decided to go out into the community to see who does what. And it took me about a year to visit everybody who's doing some work in trafficking and substance abuse. And after that year, I said, okay, now what do I do with this information? So I brought everybody together under this service provider meeting. And as it turned out, the left side of the table didn't know what the right side of the table did, or John didn't know that Jackie existed. So it was a good networking opportunity for people to meet each other and to understand what work they were doing. So now we're in our 6th year of doing that. Talked about the New England Trafficking Aftercare Coalition already. We have a first responders train the training program. And we just implemented that 2 years ago up in the state of Maine, where we trained first responders, firefighters, EMTs, paramedics, because these are the individuals going into the homes when there's a call. These are the individuals going into restaurants and retail stores. They're seeing things that we can't see. So if there's 10 women living out of a 10 by 10 bedroom with suitcases everywhere, they can say, hey, that's a red flag right there. So it's been paying dividends for us as far as the number of calls we've been getting. One of the other things just wanted to draw a distinction to between victims of trafficking. Most of the trafficking victims I see, like the sex trafficking victims, probably 95%, 98% are addicted to some type of substance. On the flip side to that, the labor traffickers, the domestic servitude victims that I see, almost 0% are addicted to drugs. 0%. And that's because the nature of the work. They're watching kids during the day. They're working in businesses or working out in the field. So their employer doesn't want them high on drugs. So there's a big difference. So it's a lot easier to place these women faster. And that's all I have. So thank you very much. And what we're going to do now, I believe, is open it up for questions.
I have a question, and I think... Well, okay. Well, testing? No? Yes? Well, words matter, and it wasn't until maybe the second presentation that I equated human trafficking with prostitution and whatever, and I think that there's a real disconnect because our perception is someone coming in on a container and it being busted at the docks. And I'm thinking about all our patients in substance abuse treatment. We identify them, we put them in trauma tracks. We don't have a human trafficking track. I think there's got to be some way of changing the wording to make our patients identifiable. All of our patients, women patients coming in with trauma, have worked in, as prostitutes in strip clubs and massage parlors, but we don't see that as human trafficking. I don't know what you can do about that, but we're not seeing it because we're not told that it's what it is.
Is this? No. This one's on? Okay, good. And actually, the saddest part about that is that it really varies state to state. In Massachusetts, closer? Okay. One of my primary area of research is state-level legislation. Within Massachusetts, the state law does equate prostitution to trafficking. That isn't the case for all states. And so that is definitely a tough thing, and it really is up to it is such a case-by-case basis in terms of how an organization, how a state, how someone wants to address this, and it can be really difficult.
One of the things to guide in discerning or identifying that would be just keeping that in mind, the definition where there will be an element of force, fraud, or coercion. So the question becomes, if somebody is identified as a sex worker, can they walk off the job if they choose to walk off? Do they have the freedom to walk off? So that force, fraud, and coercion element is there, and that's important to always keep in mind. In most situations, they don't have the freedom to walk off in these victims. So.
I totally agree with you. The wording needs to be different because the victims, again, don't even realize they're victims. They don't even know when you say, oh, you were a trafficking victim, they say, well, what's trafficking? They don't know that word. So we need to somehow or another bring it down a tone, get away from the human trafficking and say what it is. And I think you're starting that with those flyers because we need to break it down even simpler and explain what human trafficking is without calling it human trafficking so they can say, oh, yeah, I've been doing that. I've been stripping in the clubs. I've been prostituting at the massage parlor. So we need to educate a whole lot of people on what it is besides human trafficking.
Well, one thing is if we told the reviewers from managed care that we had victims of human trafficking versus patients with trauma, we could probably get more days.
Yeah, yeah, absolutely, absolutely. And the women that we're seeing now, some of the hospitals up in New Hampshire that are expediting these women, and they're great because they have that dual diagnosis piece, which they need, because there is trauma that they're going to have to recover from. And if it's not a dual diagnosis program, their recovery is going to be even longer, because these safe homes usually don't have that in place. They have to outsource it to the community. And again, it's an education process. It's educating and bringing an awareness of what this is. And it's still a learning experience for everyone. We have law enforcement officers out there right now who will tell you it doesn't exist. It's not happening.
I was wondering what your posture is towards medication-assisted treatment. You had mentioned detox facilities. In reality, I've treated a number of women who were trafficked who had been recycled through dozens of detox facilities, and really what was necessary was maintenance for some period of time, at least till the trauma work could go on, and in some cases indefinitely. Is there a policy towards this, or safe houses allowing women who are on medication-assisted treatment? Are you looking to provide those services?
We don't look at those policies. We leave it up what's going to work for the woman. I mean, it's her choice, what she wants. We try to customize each treatment plan to what it is she wants, because if we tell that person, this is what you have to do. You got to do this, you got to do that. Oh, we have this program over here that we know is going to work. It's not going to work. You tell us what is going to work for you. I've had several women who've come up to me and say, you know what, I'm seeing a doctor now. All he wants to do is prescribe medication for me. I don't want that. I don't want the medication. I want to be off the medication. I want to be off the drugs. I sent them over to MGH, and their initial appointment is a 2-hour appointment to see a woman. And after that 2-hour appointment, they've come up to me and said, thank you for sending me over there. They listen to me. They know I don't want the drug. So it's going to be a personal choice up to that woman and what she wants.
It always is, but
Always is.
My concern is whether safe houses are allowing, and many residential programs do not permit people who are on methadone or buprenorphine to be in residence.
Yeah, it depends on what safe house it is. The more intensive ones will do that, but again, it's strictly controlled. There's other safe homes that women go to, and in order to be in that safe house, they have to be somewhat stable and more independent and able to go out into the community. So it's going to vary by safe house to safe house.
Okay. Thank you.
Have you considered a private home as a temporary transitional state?
Yeah, we've actually done that too, and we've really thought outside the box quite a bit. So we've used. Oh, okay. The question was, have we considered using private homes as well? So we have, and they've been very selective as far as what homes we've used. One home, it was already vetted through Department of Children and Families. The other home was the home of the superintendent from the MCI Women's Prison, which was a really good connection. So we're really selective, because when it comes down to it, we need to find these places. We need to be creative and think outside the box. We need to, because the women aren't going to wait around. Initially, what was happening when we had that lack of detox services, we were being told 3 to 6 week wait. Well, guess what? This woman's not going to wait 3 to 6 weeks. She's going to be off and doing her thing again. So, yeah, we've looked at private homes as well, but we're very selective.
I can actually say that there are some states that use the private home model for kids, having specialized foster care. Connecticut is one of them, and they've had moderate success. It was also tried in Oregon, Oregon was not happy with it. I can say, so we adopted our son from foster care, and just in terms of the trauma and the trauma experience, it's very intense. And a lot of the times, the biggest thing that people really struggle with in terms of DCF is that the kids are going to run away. They're going to run back to their trafficker. The average exit is exactly the same as domestic violence. It's exiting 7 times. So it's an exiting process. It isn't a one-time event. And so that's the difficulty that in terms of private homes and private, particularly within DCF, is that it's incredibly difficult for people within DCF or specialized foster homes. That's one thing that they really struggle with the most is the leaving.
Absolutely. Question now, Mike first. We'll get to you second.
My question was about differentiating between, as a clinician, seeing domestic violence versus human trafficking. Can you give us some pointers on what we might see would be some differences, particularly where the victim might think that she's in a love relationship and she's the girlfriend, they're going to get married?
The victims that present at the hospitals, most recently, I can say on 4 occasions, we got calls from nurses. Someone was always present with them. They didn't go to the hospital by themselves. And when they presented at the hospital, there was someone there who always wanted to speak for them. When the clinician was talking to that victim, she never spoke up. It was always the person that came with her that said, well, this is what her problem is. She doesn't speak English, so I'm here to interpret her for her. She doesn't know where she is, so that's why I'm here. So the big thing in those situations, and when she's talking to the victim is looking towards that person. The victim isn't looking at the person who is asking the questions because she's so afraid of opening her mouth. She's going to look to who she came with. Well, what are you going to say? Are you going to talk for me? And then they might be looking at the ground when you speak to them, not making eye contact. If someone comes with them to the hospital, the biggest thing to do is to separate the both of them. Get that person who came with them, get that person who is speaking for them out of the room so you can be one-on-one with that person. And in this last situation where I was talking, they did just that. And when they did that, they found out, yeah, I speak English. No, he's not my husband. We're not related. And guess what? There's 6 other women back at the house just like me. So it's another form of control and intimidation when there's someone with them trying to constantly speak up for them.
I would also refer you to the screening tools that I put up in the slides, which will be in the slides when you get them. And I think the other difference in domestic violence from the perspective of the behind-the-scenes elements is that there is a direct profit dollar motive between the two entities. But the screening tools are one way to discern between the two.
You can also go to the Blue Campaign website. We have a website through DHS called the Blue Campaign. You can just Google it, and you can order any material you want free of charge. And there's human trafficking indicator cards there that tell you what the indicators are to look for, and they're wallet-sized cards. And we give those out all the time to law enforcement. So Blue Campaign.
I can also add that they actually may be co-occurring. There was very much domestic violence happening in my house. And so, I was a human trafficking victim, but not every person living in that house was, and yet violence was ubiquitous. The other big thing in my experience in terms of differentiating human trafficking and domestic violence is many times states or organizations will try and place human trafficking victims in domestic violence shelters. That does not work historically. And it's very interesting. The reason that it doesn't work is there is discrimination amongst the women living there, mostly women living there, that is just like the domestic violence victims are being like, well, at least I'm not a whore. At least I didn't, sell my body or whatever. So it's just in terms of the culture within the house. I think there's so much vulnerability. There's so many people trying to heal from so many different things, and there is a conflict there that really doesn't. It's not a good mixture.
It sounds like, in some respects, the area of cults accountability and recruitment are very similar with what's being done now. Only sentimentality was a big part of that here. Charismatic leaders, Jonestown, Waco, where they took control of people and they went out and they did crazy things. Well, in Jonestown, killed themselves, poisoned. So that then it seems to separate out more now. I don't think complex drugs and all are a big deal back. It's mind control.
Mind control, yeah. Yeah, we see mind control as well. Oh, sure. Yeah, the question was, he sees similarities between the way cults recruit their members as well as traffickers recruit their victims.
Maybe.
And for cults, it wasn't so much drugs, but mind control was their form of control. And with the trafficking victim, we have the drugs, we have the mind control, we have the psychological issues going on. So it runs the whole gamut as far as when it comes to the forms of control.
Can I also? I'm also adding a lot. That in terms of cults, and there is that in terms of that leader. I mean, there is that very much that hierarchical, that patriarchal way that we have the private family. I mean, so many things are in terms of cults are thought of as a family. Same thing happens within trafficking. They're called a daddy. I'll be the daddy you've never had. So it's replicating that patriarchal culture. And to me, it all comes back to that belonging, that sense of we all want to belong. That social isolation is exactly what is literally killing us. It is, our brains, the neuroscience shows our brains are literally hardwired to connect. It's just Sidhartha could probably the pathway in your brain that is social isolation is the exact same pathway that hits when you put your hand on a hot stove. We are in pain, and so you want to belong, and that is a primary recruitment component for cults, for trafficking, for all of these things is finding that belonging.
Hi. I'm from a small town in Vermont, and it's pretty well known that there's 2 massage parlors there that may or may not be trafficking. I know all the women are Asian. They have poor English skills. What can I do to help these women?
First thing, I wouldn't engage in going into the massage parlor. We tell people to stay away from it. But if you do see something, you can report it to your local law enforcement.
I don't think they haven't reacted
Okay.
at all.
We could also you go to our office. We have an office in Burlington.
Okay.
And let our office know. 2 years ago, we actually did a raid of 7 massage parlors here in Middlesex County. 26 women we took out of there from Indonesia, China, and Korea. They all went back to Flushing, New York. August of the same year, Burlington, Vermont did 5 raids of massage parlors. And wouldn't you know, it was those same women that were in Middlesex County. They just went further north. I mean, what you could do is educate on what human trafficking is, try to drop things off for them as far as giving them little cards that they can slip into their shoe or whatever. We have shoe cards available on the Blue Campaign website. My guess is they probably won't take you up on it because if they're foreign nationals, we've seen a big cultural ideology where they're doing it to send money home. They're doing it to help their parents pay a bill or to pay their bills. So it's going to be difficult, but go to our office up in Burlington and say, this is what I've been observing. They might already be looking into it because usually it takes anywhere from 3 to 6 months to investigate it because even though it might be that one massage parlor, they might be surveilling other locations, watching these women leave there and then being transported to other areas around Vermont. So you might have one massage parlor, but after the surveillance, they might have 6 more. But bring it up to them.
Thanks.
I just wanted to ask, you're speaking sort of to a room full of people sort of that are connected to the victims. And we talk about sort of victims, traffickers. The reason why it's such a large industry, though, is because of the consumers. And so I'm I think this is also a room full of people that also need to be thinking about what are we also doing to address that population if we truly want to undermine this industry and see that falling from second. So I'm wondering sort of what you would say to this room about how we can also be thinking about what we're doing to rehabilitate, I'll use that word, the consumer piece of this picture.
Want to take that one, Kate?
I will take that one gladly. I think the key thing that we need to address is child sexual abuse in this country. I think we need to heal that. It's the whole hurt people. You're purchasing sex because you're purchasing this illusion that you are in control and that you are dominant. I think another thing that we can do is really in terms of supporting, again, Ropes and Gray, they just took on, they're going to, I think it's to the Supreme Court now, actually, Backpage.com, in terms of this, really fighting this freedom of speech, that everyone has the right to sell whatever on the internet. And that is not the case. And so fighting, it's really standing up for that and letting your legislators know that you care about that. Because legislators care mostly about being reelected. I can tell you that. I've just learned that in my social policy class, actually. But that really is the key. It isn't party lines. It is re-election. And so if you let your legislators know that you care about this and that you will not vote for them in the next election, if they do not address this or support this, then that can go a long way as well. The other thing for me that is just absolutely so crucial and essential, particularly as the mother of an 11-year-old boy who is an athlete, who is good looking, who is kind of the alpha dog, he's in like the most popular, kids and all of that stuff. It is not okay for him to put down women and to score and to have 6 girlfriends and all of that stuff in order to be a manly man. That is not okay. And it's okay for him to stand up to his friends when all of that is going on, calling him a fag if he doesn't do this and all that stuff, to stand up for that, because it is that very mentality is exactly why I believe people purchase sex, particularly men who purchase sex. It is that sense of belonging, and I keep going back to this belonging, but I think it is so crucial, and we really don't talk about it in this culture, that is what it takes to be a powerful man in this culture, is to be able to have disposable income, is to be able to buy sex, to have access to sex whenever you want, to be able to talk about your sexual exploits, to talk about, to access porn at any time, to be able to live out that whatever you want to do, and then to talk about it with your friends. That's the thing. Really another amazing academic who's done great work. His name is Michael, and I'm forgetting his last name. It starts with a K. But he has this wonderful book, Guyland, and he's talking about college fraternity brothers who their primary thing is when they're having sex with a woman, they're not, and this is very heteronormative, I get it, but at the same time, when they're having sex with a woman, they're not in the moment, they're thinking about how much they can't wait to tell their friends that they banged this particular woman. So I think that is also a primary thing. And we think about, it's, the average when you have a bachelor party, of course you get a stripper, of course you go to a sex club, of course you do this, of course you do that. Those very norms, there really are ways that our brothers, our husbands, our cousins can interrupt that stuff, and say, no, I'm not going to do that. I don't want to do that. I don't have to do that to be your friend. I don't have to do that to be a powerful man. And if someone says, well, you're just a fag, well, that person, then you can come back and say, you don't need to shame me, because that's what calling someone a fag is, just trying to shame that person to be able to control that person to going back to the norm. You won't be popular doing it, I promise you. My son is like not happy, but he's like got his feminist mom, kind of going after him on this. But at the same time, I'm incredibly grateful that all of his friends, all of the families, all of the mothers, the fathers, we are all really good friends, and we talk about this stuff all the time, because one of his very best friends will definitely be the quarterback. He will be the quarterback of the high school team. His father was the quarterback at Harvard. Very talented athlete. And at the same time, we talk about that importance, the importance that these boys don't grow up to be racist, not that too, but rapists. That they don't have just because they are particularly good at throwing a football at 11 years old or 18 years old doesn't give them the right to women's bodies. And it doesn't give them the right to put down other kids. And it doesn't give them the right to say, I'm the king of the world, all of this stuff. But that is everywhere. And so I think by standing up for that and being vocal about that, that's what it's really going to take. And that's the long, hard work, but really transforming this culture of masculinity and patriarchy is absolutely essential.
There was actually a research study that was done in 2011 right in Boston. It was done by the Abolitionist Network for the APA Association, and they actually looked at who the buyers of sex were in the Boston area. You can actually Google it. It's very detailed. They also asked them, well, what could be done to curtail you from buying sex? And they listed the things that could be implemented that would stop them from buying sex. But guess what? You don't see any of these things happening. Some of the things they said were increase the the penalty for fines up to $2,000, confiscate their cars, put their names and photographs in the newspaper, on billboards. These things are coming from the people who are buying sex. But why aren't we seeing these things? Well, who are the buyers? Who are the buyers? It's big business. There's state legislators, there's federal judges, you name it, they're out there. That's why you're not seeing it. I talked to a state representative who is trying to strengthen the bill on trafficking. And in Massachusetts, there's a John School out in Worcester. They have to pay $750 to attend this school. And again, they're caught buying sex. Well, he was saying, well, they want to do away with the $750 fee, all right? Well, if it's a hardship for that person, we can reduce the fee. You don't have to pay $750 if it's going to cause you a hardship. If it's really a problem, we can waive that fee, and you can go to the class that way. I said to this guy, I said, have you ever heard of a payment plan? I said, everybody and their brother is on a payment plan these days. Put them on a payment plan until it's paid off. And on top of that, charge them another $2,000 fine. So there are ways to do this. We have them telling us what it will take. Why don't we listen?
Good one. And I also want to just say, talking about the culture and the masculinity, there is a couple of organizations you can look at from men to make a difference in this. There's a Mankind Project. There is different chapters. Cape Cod has a chapter called Mankind Project. These are men working on stopping violence against women. There is a White Ribbon campaign you can look at, and those are looking at how to change the patriarchal culture. So that's another thought. Thank you.